I'm Erick Bournigal. I've been here since 1990, so about 30½ years. I'm a rheumatologist now, but when I moved here in 1990, I specifically came to Brunswick because I had the opportunity to do all the intensive care work that I did all over Northeast Ohio in my last years of training. When I came to Brunswick, I found a hospital that surprised me with the sophistication of the physicians that were here. And I saw my opportunity to come and join a place that I thought had a standard of excellence that I did not see in most of the smaller hospitals I had visited all over the southeast of the United States, where I had always planned to work, just because I got tired of winter. But once I got here, I really found lots of surprises. A lot of my Yankee colleagues had warned me that I'd never be accepted in the South, and instead I found that in Brunswick, if people felt that you were trying to help them, you were accepted right away. Never once felt like an outsider. And after all these years of remaining here, I feel that way still. My first day here, I had to go in with a nurse that was a translator. After all, my very first patient told me that the reason she was seeing me was that she had fell out. So, as any self-respecting Yankee, I felt obligated to ask, "What did you fall out of?" which prompted the patient and the nurse to bust out laughing, and my nurse to run out and announce to the entire office that I'd asked her what she had fallen out of. I had to be educated that "done fell out" meant that she had fainted. So I didn't ever make that mistake again. When I first got here, I was part of a class that included only 3 new doctors, including Hewitt Maddox, who will be making one of these videos, and a very good friend named Terry Harris. I want to mention Terry because he was a great doctor and a great colleague. He ended up dying of cancer at age 44, but when I had this opportunity to share my history, I felt like I had to bring up Terry as someone that was a caring and kind doctor, and wished that he could be here to give his own history as part of Southeast Georgia Health System. What's a good day for me? Well, I have lots of good days because I think I really laugh through every day with my patients. I've got some super serious patients who don't get my sense of humor, but thankfully there's very few of them. And I've got lots of one-liners that I've learned over the course of a year to keep my patients laughing. Of course, my family is tired of all those jokes. Once I got here and people had trust in me, I felt that trust. It kept me here. It kept me wanting to live up to their faith in me. And I never had much yen to leave this area. Once I got here, in fact, I've been very happy to have accidentally stumbled onto this place. And the reason I found it, by the way, is because I had a friend that I'd known since I was in kindergarten up in the small village of Rocky River, Ohio, and he came here to open a restaurant, and I came to visit him and decided that this was a wow place. And then when I really interviewed with the hospital, I was really pleasantly surprised that it just seemed to be a perfect fit for me.
I've known Dr. Bournigal since about 2012 when they became on with Southeast Georgia Physician Associates, when they became part of the health system. And I was able to work with him on the early days. They transitioned the practice from private practice to health system owned. And it's been a pleasure to work with him all this time. So Dr. Bournigal is the only rheumatologist in our service area, and he takes that very seriously. So if you're having a rheumatological issue, you're seeing Dr. Bournigal. So he takes the weight of that on, and he really appreciates being the one to provide care to all these patients. Dr. Bournigal, if you're talking to him, you're never bored. Dr. Bournigal always has a story to share. It's usually a funny story about where he came from, about his time in practice. Whatever it is, if you have a subject, Dr. Bournigal can keep a conversation and tell you a funny story about it. I don't know where this hospital really would be without Dr. Bournigal, because not only has he been a rheumatologist, he's been chief of staff, he's been chief of medicine. The leadership he's provided to this hospital is really too much to even explain.